This program is brought to you by Emory University.
I was at the beach and I'd never had trouble walking or doing anything like that, and I found out that I could not walk a half a block without getting out of breath. I've never been so shocked in my life because I'd been real athletic and active all my life.
Before, I had shortness of breath, and I was very, very fatigued. I couldn't do my housework, and really it was getting hard for me to walk from one end of my house to the other.
Basically, I was feeling more tired. I didn't feel as winded, I think, as most people claim they are, but I felt tired a lot, and yeah, I didn't have the same stamina.
I was extremely short of breath. I had a meeting on Peachtree Street about a month before I had the procedure, and I had to walk up a slight incline, and I had to stop 3 times and get my breath.
One of the places that's close by, he said, was Emory University Hospital. And he says, if you want, he says, I'll make a call to them, which he did, and they accepted me.
My doctor in Birmingham suggested I come to Emory. So I did, and I got interviewed for the program.
She said, I'm checking into Emory, and Elise said, I'm talking to Tricia, and it sounds like that would be really the place to go.
We're just so delighted with the whole business of coming to Emory Hospital to have my husband have his surgery done here, because it was researched, quite honestly, and we decided this was the real place we wanted to be. My first husband, Robert, was diagnosed with aortic stenosis at the age of 33, and he passed away as a result of it. And my second husband, Emil, here's 46 years later, was able to have the latest surgical procedure performed, whereas he is guaranteed a very successful heart operation with it, and many years to come, hopefully.
Today, I could never have done all the walking I had to do to go from one room to another, and it's just amazing that they can accomplish so much with so minor intervention. In other words, they didn't cut anything, it's amazing.
I can certainly take care of myself, and I have resumed doing housework, and it's just made all the difference in the world, in my life.
It was, I think, pretty remarkable, having talked to people who had the slice down the chest operation, that I came in on day 1, had the procedure, and went home the next day.
I thank Emory. Everybody's so gracious and good, even those people behind a desk. You know, this is one of the nicest places I've ever seen.
The Emory TAVR team was outstanding. They were pleasant, and they just made me feel so at ease that I had no concerns whatsoever.
I would just say thank you to Emory and to all the personnel and all the programs that they do for helping me make my life a better life. Thank you.
Great hospital, great attendance, great, everyone was just wonderful, and we're just happy with the whole experience.
The whole concept of this program really began 40 years ago in the early 80s when a French cardiologist named Alain Cribier did the first balloon valvuloplasty on an aortic valve. Here we are 40 years later, and we've now come to our 1,000th patient that has had an implant of a transcatheter aortic valve. In order to make that happen, a lot of things have to sort of come together. And part of this is the fact that there has to be a collaboration, a heart team that allows a good evaluation of each patient that is going to have such a procedure. Robert, what do you think about the heart team business? How did that work?
Well, I think that the heart team begins with trust and knowledge of each other's skills and working together in the trenches. And I think that you and I have done that. We did that at the Mass General
100 years ago.
But about 25 years ago. And when this was getting started, we knew that we could work together, and I knew that you had skills and techniques that needed to come to this platform, and at the same time, the surgeon's knowledge of anatomy and how to retrieve difficult situations was a huge contribution. So I think that together we were much more than we were separately, and that's what brought the heart team together and made this accelerate. And the partner trial was aptly named because this was a partnership from the very beginning between cardiologists and surgeons working together. And you and I were kind of the people who helped bring it to Emory, but on the other hand, we knew that we had dynamic young people who were going to carry this forward, and we had great confidence in the two people that were our partners in making this happen.
We like the word young, by the way. That's a good thing.
So Vasilis, tell us about your experience going to see Alain Cribier, the first guy that put one of these in.
Yeah, I think that for a young physician coming out of training, this was really a kind of a dream come true to go someplace and be part of some early feasibility. I went to visit Alain Cribier in 2004 to interview for a position of fellowship for a year, and Peter was very instrumental in setting that up. And what I saw in the one day there really kind of changed my complete understanding of what could be done with endovascular repair and endovascular therapy. So I signed up for a year with the French team and was able to gain a lot of skills that very quickly we couldn't do in the United States because they were only being done in Europe. In fact, they were only being done in one center in France. And then to bring them back and integrate with the whole team, I think was very powerful and valuable.
So it's interesting also, as Robert talked about trust, I was only 2 years out of my practice when Robert sent me to China and Germany to see transcatheter valves and catheter skills, and came back, and then you had finished your year, and we kind of meshed it together, kind of walking literally on the shoulders of giants like the two of you. The two of us have been able to kind of take that legacy that you built and take it to the next level, which has been, I think, instrumental in how we've made this go forward and gotten to this point.
Well, I think the other thing exciting thing about the partner trial is the transcatheter aortic valves have led us into the next era and have taken us, put us in a position nationally, so industry now is coming to Emory and saying, how can we work together to move to the next level? And I think you've been very instrumental in that piece.
Yeah, I think that some of the stuff that we've talked about, we just saw at the American College of Cardiology meeting, the SAPIEN 3, which is a third-generation valve, and the results are absolutely groundbreaking. We're talking about numbers that are staggering as far as low morbidity and mortality. And as we have now moved into that aortic technology, now we have mitral technology, and it's very exciting to see how we're not only going to be able to work on aortic valves, but mitral valves. And we all participated in a case recently that was very, I think, kind of blew us away. And so we have a lot of future ahead of us. Like Peter said, this was 40 years ago when it started, and I feel like we have another 40 years, and we're going to be doing some great stuff, hopefully together.
If you look at how the story unravels from beginning to where we are currently, it's serendipitous, but it's also could not have come together any better than the way it did with the four of us at the right place at the right time, starting a heart team. And now we have quite a big team with more cardiologists and more cardiac surgeons, a lot of them that'll be with us tonight for this gala celebration. And in the institution that has been able to support this type of growth with a lot of vision moving forward. So
we now have built an army, and a lot of people here today. And it's not just the four of us and the physicians. We have research staff, we have nurse practitioners, we have physician assistants. So we're really in administration, like you said. So we're really blessed that it's gone from the two of you to a lot of us, and you've built really a family of this type of heart team mentality, and so we're very grateful for you guys.
Right, and I think the focus remains on the patients, delivering to the patients the best technology, giving them the simplest, most straightforward procedure to relieve their disability. And that's the great thing about structural heart, is we take disabled people and enable them. And that's the most rewarding part of everything that we do.
And the patients are a large part of this. You know, the patients are taught by us about what's going to happen, what they can expect. But the patients also teach us, and I think it's important that part of this, a central part of this, is the research of going forward and understanding how in the future we're going to do different kinds of valves and actually grow this program to make it even the larger one.
Neuroprotection, that's the other thing. We want to try to prevent some of the morbidity that does occur. And we're hopefully at Emory, we're poised to be able to bring these new technologies to not only Atlanta, but Georgia and the Southeast.
Yeah, I think we have to emphasize that patients have been a huge partner to us, an asset in the heart team. And they've taken risks in order to get better and for them to potentially benefit, but also for many patients after them to benefit from their contribution to science.
Yeah, they may thank us, but we have to thank them.
No, the celebration is really about all of us being able to support the patients.
This has been a fantastic journey for us as we put this team together, but it really is a continuing journey for the team. This 1,000th celebration is just the beginning. We think this is just the tip of the iceberg as we move forward. And we welcome everybody tonight to this celebration. This is patients, nurses, the cath lab, the operating room, the administration, the physicians. We're all in this together to make this happen for the advancement of the patients and the advancements of science. But welcome everybody. This is our celebration. This is your celebration. Thank you for coming.
The preceding program is copyrighted by Emory University.